Hi, my name is Lorris Herenda. I'm the Chief Executive Officer of Yellow Brick House. Now, some of you may be wondering, what is Yellow Brick House? And I wanted to just quickly review our vision and our mission statement. So at Yellow Brick House, our vision is freedom from violence and equality for all. And our mission statement is that we provide life-saving services and prevention programs to meet the diverse needs of individuals, families, and communities impacted by violence. I wanted to spend the next few minutes talking to you about prevalence of domestic violence, because a lot of people are not necessarily familiar with the statistics and the prevalence that's impacting Canadians. So some of the stats that I'm sharing with you are staggering and quite impactful. 51% of the Canadian women have at one point in their life been abused. That's more than half of Canadian women. 67% of Canadians know a woman who's experienced physical or sexual abuse. And in fact, in Canada, an act of male violence against women occurs every 6 minutes. A UN report that was published in June of 2019 indicated that the most dangerous place for a woman is in her home, with over 55,000 women killed worldwide in a year. In Canada, every year, over 360,000 children witness violence in their homes. An orthopedic fracture clinic study revealed that 17% of women that they see experience violence in the last year, and 33% of them in their lifetime. Canada Chief Public Health Officer 2014 reported that just under 9 million Canadians have reported experiencing abuse before the age of 15. That again is 1 in 3 Canadian women. More than 766,000 older Canadians experienced abuse and neglect in the previous year. And financial abuse occurs in about 94 to 99% of domestic cases. Now, most recently, since the start of the pandemic in 2020, a woman or a girl has been killed every 2.5 days in Canada. In fact, violence against women and children has become a public health issue of global importance. And only 36% of female victims of spousal violence call the police. So a lot of them, a large percentage of it has gone unreported. So what are the consequences of the prevalence of domestic violence? Well, first we're going to examine the consequences on our society in Canada. Annually, we spend over $7.4 billion on domestic violence. Health-related costs alone are over $1.5 billion per year. Consequences of domestic violence on women is, of course, the most tragic one, death. We know that half of the women who are living in violent homes experience post-traumatic stress disorder. 60 to 80% of them actually have acquired brain injury from the physical assault that has taken place. 40% of physical abuse starts during the pregnancy. And women living in violent homes have an increased suicide rate, 2 to 4% higher than women who are not living in violent homes. Next, we're going to examine the consequences of violence on children. Children who are living in violent homes are at risk of being abusive or abused in the future. Children living in violent homes have trouble learning new things. They may exhibit behavioral problems, low self-esteem, high anxiety. 60% of the children living in violent homes experience post-traumatic stress disorder, and they have an exceptionally higher suicide rate, 6 times higher than children who are not experiencing violence. Furthermore, children in violent homes, they also may experience behaviors of physical self-abuse, substance use, eating disorders, emotional instability, aggression, and shockingly, the presence of high cortisol levels that are present because of the environment that they live in actually impact their brain development. The next slide is going to actually demonstrate that. The next slide shows actually a scan of a 3-year-old, 2-3-year-old children. The one under normal living conditions, you can see the brain development following its natural path. And the second scan shows the scan of a 3-year-old child who is living in extreme neglect. You can see certain areas of the brain have certainly not developed, which impact their behavior, their learning ability, and their social skills. Overall impact of violence against women and children is that it goes beyond the physical injury and there's an increased risk of depression, anxiety, post-traumatic stress disorder, high blood pressure, cancer, and heart disease. And family violence has been deemed a silent pandemic long before COVID-19 pandemic started. So now knowing a little bit more about the prevalence of violence in our society, I want to talk to you a little bit about what it is that Yellow Brick House provides to support the families who've experienced this in their lives. So at Yellow Brick House, we offer 4 core programs. We have 2 24/7 emergency shelters for families who are fleeing violent homes. We offer a 24/7 crisis support line. Then we offer community counseling and supportive services, and I'll provide more information about that. And fourth one is our prevention program. It's our public education. So I'll get a little bit into each one of those categories. I also have some photos from our facilities so that you can actually get a visual of what a shelter looks like. Both locations are fully confidential and they're staffed 24/7. We have security cameras that surround the exterior of the building. All the windows are bulletproof at our shelters, and we have alarm systems that respond to sound, forced entry, and breakage. As you can imagine, security is topmost priority for us. And we also know that the most dangerous time for a woman and her children is when she's leaving the abusive relationship, especially the first 6 months. So we really emphasize a high degree of emphasis on security and keeping them safe while at the shelter, and do a great amount of safety planning while they're outside of the shelter as well. So our Aurora location, you have some photos in there of our family room and our resource room, where women, as I mentioned, have access to staff 24/7, and all of our frontline staff speak at least one additional language. So we're able to provide services in over 30 languages, which is very important given the high level of different languages that are actually spoken in York Region. I believe there's over 120 registered languages that are utilized in York Region. Now we have just over 30 of them, but we do utilize the services of interpretive services when required. Here's a snapshot of our bedrooms. They're nothing fancy. Most beds are twin size or bunk beds. It can be crowded, and because each bedroom also has a crib. Women do share the accommodation. Pre-pandemic, they share the accommodation. And I'll get into post-pandemic what that looks like. But even though it's quite simple, women have indicated to us that that's the first time that they slept well. They slept in peace and not in fear. Their average length of stay in the shelter can be between 6 to 8 weeks, sometimes longer, sometimes shorter. It really depends on each individual family's circumstances. But while they're at the shelter, they receive crisis counseling, they receive supportive services, they receive a family court support program, really anything that the family needs to get back on their feet and to resume living independently in the community. Next, showing you the children's room at the Aurora shelter. We have children's recreation and advocacy workers that work with kids, providing them recreational activities, respite care for moms, especially if they have smaller children, lots of babies coming in through the shelters. And they also help women and advocate for women with schools and Children's Aid Society if they happen to be involved. Our next few slides will show you our emergency shelter in Markham, which is a newer location. We opened this location 10 years ago. It looks a little bit more modern than our Aurora shelter, and it would really benefit from the pro bono services of an interior designer, this location. So this is the resource room and the family room at the Markham location. Next few pictures indicate the children's play area and our kitchen. So those are our shelters are really homes, but they're safe homes where families can start rebuilding their lives. So, and also within these shelters is where we offer the 24/7 crisis support line. So if a woman or a family member or a child needs to call to get information about services, get the support, get the help, get the assistance to get out of a dangerous place, we are there to help 24/7. Next, I want to speak to you about what we internally call our outreach program, but it's really, the term is community counseling and supportive services. We actually have 7 different programs that we offer, which includes individual counseling for both women and children, transitional housing support workers, women's support groups called When Love Hurts, Handle with Care, which is a parenting group, family court support at the Flick office, courthouse in Newmarket, and 2 newer programs, post-pandemic, our housing worker and our immigration consultant. So I'll get into more information now for services that we offer for children. Our children take part and it's meant for all the children that witness violence, a Let's Talk program for ages between age 4 to 18. And it's a 10-week program during which children are actually taught, instructed about healthy relationships. They're talked to about the changes in the family structure. And most importantly, we address the fact that it is not their fault and give them tools to help deal with the changes in their lives. We also provide individual counseling with children ages 4 to 18, usually about a 10 session period where we address some of the changes perhaps in their behavior and understanding of what's happening in their new world, and provide them with tools and systems to resolve those issues. We also offer a Mothers in Mind group program for moms who have younger children, so newborns up to the age of 4, and we work with moms to reestablish their attachment with the children. Women who've been traumatized and have post-traumatic stress disorder sometimes are struggling in connecting with their children, so we help them bridge that gap and solidify that relationship. And the 4th program that we are just about to roll out is called our Caring Dads program. And this is a program that we are going to be running with fathers who have been abusive towards their partners and their children, or have the children witness the abuse. So we're going to be working with the fathers to help them understand the impact of their behavior on children. This program is research-based and evidence-based, which shows that once some perpetrators understand the impact of their behavior on children, they are more invested in changing their behaviors. And lastly is our public education program. Again, a variety of different programs that really focus on healthy relationships and dating balance, because we believe we need to invest in prevention to change some of the tragic statistics that we're currently experiencing in our society. So we have Schools for Change program, which is abuse prevention workshops geared to students from grades 7 to 12, where they really start during this time period, they're thinking about their dating and they're liking each other and getting into those relationships and really helping to understand about self-esteem, about respect, and about what a healthy relationship may look like. We also work with colleges and universities, with the students there and other professional groups, again, focusing on healthy relationships, keeping safe, identifying some of the risk factors that they may detect when they start a new relationship. In addition to working with youth and schools, we also work with corporate groups, providing workshops on Bill 168, which is workplace harassment. That does also include domestic violence. We'll provide lunch and learn sessions, really offering the employers resources for their employees and employees an opportunity to be able to reach out in case they require assistance. And in the last few years, we partner with St. Andrew's College, which is an all-boys schools, and provide boys-only programming, where again, it's about really educating them about respect and relationships and how and their behavior towards the opposite gender. So now that I gave you a summary of what it is that Yellow Brick House does, and I have to say we are always looking for new opportunities to develop new programs when we identify certain system and service gaps. And the pandemic has certainly been a time for us to really, on a continuous basis, evolve and change and upgrade and respond to the growing need. So some of the COVID-19 immediate impact, just to summarize, is in March of 2020, government issued a lockdown, stay-at-home orders, and what we immediately noticed in March of 2020 that there was a almost a immediate reduction in number of women and children that were coming to the shelters, and we realized, well, they were really stuck at home with their perpetrator and had not an opportunity to escape. Pre-pandemic, if the perpetrator went to work or could pick up a phone or text us and get out of the home. But now that they were staying at home together, women were having a hard time escaping that situation. We knew that on a national level, domestic violence increased by 30%. The reports were coming out that it's escalating now that their stay-at-home orders were in place, yet calls to a crisis line were dropping. We also knew that many shelters in Ontario stopped taking in additional women and children because of the public health guidelines and not really being able to ensure the physical distancing in their shelters. And in some areas in Ontario, public health guidelines prevented shelters from taking women and children from other regions. So a woman, let's say from Toronto, couldn't get a space perhaps in Durham because of being in a different geographic setting. So there were a lot of inconsistencies and restrictions that were being implemented across Ontario that were having a negative impact on women and children being able to access shelter beds, in addition to the fact that they were in a lockdown situation and could not sometimes get the help and ask for the help that they needed. Very quickly, there was a development of a hand signal that you'll see on the next slide here. As we move to the virtual world, we realized that it was important that there was a hand signal that if a woman is talking, abused woman is talking to anybody else and her life is in danger or she's feeling unsafe at home and her children and she needed help, she could literally lift her hand, put the thumb across her palm and close her fist. That was a signal that she needed help, and anybody that detected that could call 911 and send the police to that location where they could intervene and connect her with the resources that she needed. So the pandemic made everybody quite innovative, and we knew we had to act quickly to assist the families that were in dire need of assistance. Some other impacts that pandemic had immediately was the court system shut down. Perpetrators that were being arrested were also being released immediately because there was no space or they didn't want to keep them in the jail. And women who did manage to escape the violent homes with their kids were sometimes asked to return the kids to the abusers because the abusers were making cases that shelters were not safe. And they were concerned about their children's health for COVID reasons. And that made it very difficult for women to remain in the shelters because they didn't want to lose their children. And often they returned to the perpetrator with the kids just so they can be with their children. There was a lot of messaging. Women were telling us they were able to reach out to us that their partners would say, shelters are not safe, you can't go, you can't escape, there's nowhere to go. And we also know that there were economic impact of COVID-19 where many jobs were lost, businesses were shutting down or slowing down. And there was approximately about 1 million jobs that were lost, and 63% of the jobs impacted women. And 70% of those were between the ages of 25 and 54, which really immediately further became a huge obstacle for women leaving their abusive relationship, because if you don't have the financial means to support yourself and your children, then you feel like you have nowhere to go. As I mentioned a few minutes ago, we knew the reports were coming in, domestic violence increased by 30% nationally. And currently, as we're still in the tail end of the pandemic, we know that we're currently experiencing a food cost crisis and overall cost of living with the inflation and high interest rates. And it's further placing a disproportionate amount of women at risk for financial abuse. We also know that femicide rates increased by 53%, and our provincial association actually collects data on an annual basis on women and children that have been murdered by their partners or family members. And we've seen a 53% increase in femicide. This last year alone in Ontario, we lost 54 women and children. And those are preventable deaths. Those are tragic deaths that we need to really work towards raising awareness and breaking the silence around gender-based violence. So from the start of the pandemic till August of this year, we lost 130 women and children, which is unimaginable. The next part I want to talk to you about is, so what did we do as an organization and as a community to respond to some of these things that were really throwing our families into a situation of even increased risk of violence and death? So I can assure you that our sector was very busy in trying to really find solutions to some of these things. So number one thing that we did in York Region was within 2 weeks of the pandemic being declared, when we realized that our shelters were not designed to offer families an opportunity for physical distancing, because they were designed as congregate living settings where women and children shared bedroom space. So a woman with 2 children, a woman with 1 child could be in 1 bedroom. And we couldn't ensure physical distancing, as I mentioned. So we created transitional isolation units in collaboration with Sandgate Women's Shelter of York Region. They actually converted one of their shelters into a family unit. So they went from having 20 beds to having 3 family units that were offering up to 16 beds. And all our staff and Sandgate staff were working collaboratively on site 24/7, and the isolation unit is actually still open. It's going to be open till the end of December. So we've been actually in functioning from May of 2020 until December of this year in these isolation units. These units enabled families who are coming into our system to isolate as per public health guidelines for 14 days at that time. Now that has been reduced to ensure that they were COVID-free. And once that 14-day period was up, they would then move into another shelter or alternative housing, emptying the space, isolation space for a new family coming in. And this project was essential in ensuring that no woman and no child did not get a shelter bed, because we were able to keep them isolated, keep them together, and keep them safe. We worked very closely with public health in this transition, where public health was actually coming on site at the transitional isolation units to test the families when the testing became available. And that really improved, that collaboration improved the impact for the families who were staying with us. The second thing that we had to do, now that we had the family units, we had to, and women did not have access to the kitchen, or they would have access to the dining room at their set times per family unit. We actually hired a cook who prepared all the meals for the families in the transitional isolation units. As I mentioned earlier, once the women and children were they completed their 14-day period at the isolation unit, they were moved to back to the shelters, or I would utilize the term alternative housing, because not all our shelters were still on par to accept families and ensure physical distancing. And at the alternative units, the women lived independently, again within their unit, but they had 24/7 staffing support. And staff delivered meals to the families who were in the alternative housing. There was a lot of commitment from our volunteers and our staff to make sure that these families had access to nutritional meals and they were supported 24/7. At one point, we were able to secure some funding to purchase grocery cards, so that women were able to get the grocery cards and purchase what they needed for their families and prepare their own meals. The children that were staying in both the isolation units and also in the alternative housing model during the pandemic, they still needed to get the support. The kids were learning virtually, and there were a lot of struggles for many children for that. So we wanted to make sure that they continue getting the support from our children's recreation worker and our child counselor. So they received virtual, individual, and group support. In 2022, in the summer, we rolled out a social media campaign, just basically letting the community know that, hey, we're open, we are safe, we're COVID-free, and we are here to help you. And you know what we saw happening after the social media campaign was there was an actual increase in crisis calls and women and children coming to utilize our services. So we knew the transitional isolation unit was a success, and utilizing alternative housing units on a short-term basis was also a success, because women were able to continue being contained within their unit and without risking any exposure to COVID. So that was our big project right from the start of the pandemic. Then we realized that, hey, we're having families here in alternative housing units, and it's their own unit and they're supported, but we needed to get them out in the community, because those alternative housing units had to become available for the families coming out of the transitional isolation unit. So we hired a housing worker. And what the housing worker did is help women find market rent, advocated with landlords on behalf of the women and children who are looking for housing, and actually helped secure housing for the families, which meant was women did not have to stay as long in the alternative housing. They could move into their market rent unit with their children. That increased our capacity to intake more women and children who are fleeing violent homes. Now, you may ask yourself, well, how do you get them into market rent? Because market rent is incredibly expensive, and how do these women manage to financially support that move? which brings us to our third project that happened during the pandemic. It's what we call the Liberty Project. As you know, as I mentioned, market rent is expensive, and women and children need financial stability to afford the rent. So in partnership with Blue Door, we rolled out the Liberty Project, and that was our name for our families, our project, and Blue Door called it the 200 Door Project. Their focus was on supporting individuals or small families, so a woman with maybe one child, and helping them find housing. And our project was to help families with 2 and more children. And what the project actually did, and this was through Reaching Home grant through the federal government, that we were able to provide each family financial support with the startup cost, with transitional packages that they needed, and rent top up for up to 6 months. And that's how they were able to secure housing and maintain housing, because they were given the stepping stone to be able to financially afford that move. As you can well imagine, women and children who come to the shelter, they come basically with the clothes that they're wearing. They leave everything behind. So the transitional packages, they're very important when they move into their own units to have cutlery and plates and mugs and bed sheets and towels, all the things that we take for granted. But that's a startup that they need to help rebuilding their lives. And of course, the 6 months rent top up was a huge success, because in that 6 month period, while they're getting that assistance, they were able to save money, find jobs, find alternative support systems, so they can continue maintaining that housing. Our fourth project was conversion of our existing shelters for the future. As I mentioned earlier, pre-pandemic, majority of shelters were designed for congregate living setting, where families shared living space, they shared the kitchen, the bathrooms, and whatnot. And we knew, in order to keep families safe in light of the COVID-19 or any potential future infectious disease, we needed to convert our shelters into individual family units. So we were able to secure some capital funding from various sources to convert both of our shelters. So in pre-pandemic, our Aurora shelter had 25 beds and 7 cribs in a 7-bedroom home. And our Markham shelter had 16 beds and 3 cribs in a 5-bedroom home. And pre-pandemic, we offered total 41 beds and 10 cribs. And when we knew that by converting the space into family units, we may potentially lose the capacity. So as I mentioned, we secured the funding to do the conversion. The Aurora shelter went from a 7-bedroom to a 4-family unit shelter, totaling 16 beds and 4 cribs. So we actually lost capacity of 9 beds and 3 cribs. Our Markham shelter, given the layout of the property, we were able to create 5 family units, and so we kept our beds and our cribs. So Aurora shelter was the one that was most impacted by the loss of capacity. But having said that, now we were set up to take in families and keep them in family units, keep them isolated as a unit, and keep them safe. We knew that the number of shelter beds and cribs that were available pre-pandemic were not enough. On any given year, we were able to serve about 400 women and children coming through our shelters, and about 800 women and children could not get a shelter bed. This is pre-pandemic. So now, with the reconstruction, we lost 9 beds and 3 cribs, and which really spoke to our need. Next project, what do we do? What do we do to bring back our capacity and still keep everybody safe? So lo and behold, we said, okay, we need to find a funding pot to help us reinstate the beds. And we were able to secure federal funding to expand our Markham shelter, where we are going to be adding actually 5 units with 15 beds and 3 cribs. And the renovation starting now, and it will be completed by March 31st, 2023. And we're so excited that we're able to bring our capacity back to what it was pre-pandemic. And again, having those family units and being ready for not only COVID, but any infectious disease that may come knocking on doors, we'll be ready to keep the family safe. And there's, there's a couple of other areas that in terms of service and programs that we identified is we've seen during the pandemic an increased number of women coming to our shelters that did not actually have status in Canada. Which meant that, and they didn't have money even to submit an application for status. And this rendered them ineligible to get any financial support, to get housing, and put them in a very difficult situation because now they were concerned about their losing their children, being sent back to their country of origin, and getting assistance of an immigration lawyer, especially during the pandemic, was very difficult and almost impossible to find in York Region. So we decided to hire an immigration consultant, again with project funding. It was new. We hired her. We also created a small sponsored fund to cover the women's immigration application fee, which can go up to $650. It doesn't sound like a lot of money, but it's a lot of money if you don't have any. And once the application is filed, now women are eligible to access financial support and housing while they go through the process. So this program has been extremely successful. And if any of the service providers that may potentially be on this conference, if you have any family that is in a similar situation, please give us a call and we're able to assist her. And the last program that we decided to roll out is we've been for 44 years, we've been providing intervention programs and services to abused women and children after the fact. Investing also in our prevention programs with youth and community about healthy relationship and dating violence. But who is working with the dads? So we had a conversation, service providers, internally and externally, saying we need to start educating perpetrators about the impact of their behavior, if not on their immediate partner, then on their children. And doing some research about some of the programs that were developed in Canada and outside of Canada, we came across the Caring Dads program. We hired a male counselor, group facilitator, and it's going to be starting early December, November, early December. It's a 14-week group intervention programs for men who have abused their children. It's not court mandated. It is completely voluntary. So it's really meant for individuals who are realizing that their behavior has broken up their family unit, has had a negative impact on their partner and on their children and on their relationship status, and are interested in recovering some of that. It is child-centered program, so our focus is on children, but we're working with dads. Again, this called for a partnership in our community because we couldn't utilize our shelter space or our counseling space to deliver the service with that. So we needed to have space offered by another community partner, which we secured. And so we're able to conduct these groups. And We don't know the outcomes of the groups yet, as the program is about to start, but we are definitely going to be collecting data, both statistical and qualitative data, to see, to measure the not just the outcomes, but the impacts. And I do believe that it's necessary to work with the family unit as a whole to recover from the impact of trauma, and to really build stronger bridges for their future. So in summary, some of the lessons that we learned are that partnership and collaboration, we always heard about it, but during the pandemic, they became crucial in increasing our reach and our impact with families who are facing dire situations. We cannot work in silos. We have to be able to collaborate on grant writing and partnering on grants so that we can have access and support and build together using our resources together, because that quadruples the impact on the families that we serve. We need to continuously address system gaps and system challenges on regular basis, literally on monthly basis. What are the issues that these families are facing when they come in? What are the stories they're telling us? What are the obstacles they're facing? And can we, either individually or collectively, be able to develop a program, seek a funding source, or come up with an innovative solution to assist them? And we can't continue our work, well, we're funded for this, so we're going to deliver this. We have to say, we're funded for this, we're going to deliver this, but we're also going to look at what gaps are existing and how we can assist families who are falling through those gaps that have been created and developed for whatever reasons. We always must remain client-centered and listen to survivors. This is not our journey, this is their journey. We're there to assist them in their journey. And when they tell us these are the obstacles we're facing and these are the system challenges we have, collectively we must support them in developing a solution to address those. We must call on all levels of the government to review the 86 recommendations of the Office of the Chief Coroner's review of the gruesome homicide that took place in Eastern Ontario. This report was really released this summer in August, and it really very clearly defined that we must declare intimate partner violence an epidemic in Canada. That is how bad it has become. There has to be sustainable funding for violence against women agencies to continue providing intervention programs, because if we don't have sustainable funding to keep our services going, to keep our shelter beds open, women and children are going to die. They've also recommended that there's an establishment of a She Fund, She Can Fund, and there are small grants for up to $7,000. This is very similar to what I referred to earlier, the program that we had called the Liberty Project, where women can get these grants that are interest-free and can help them with market rent, can help them with getting their transitional packages or their general startup costs. And last recommendation was, there were 89 recommendations, but they really fall in these 4 categories. Prevention programs are necessary through education, because unless we educate our youth and our community about the impact of violence on our country, we're not going to see a decrease in violence. We're not going to see a decrease in homicides. So collectively, we must continue raising awareness. We must continue getting involved. We must continue ensuring that violence against women and children is a nonpartisan issue and has to be on the agenda for any political party, in power or not, to have a conversation about this, because collectively we must work together to help families impacted by violence, and also work towards reduction in some of these devastating statistics. November is Women Abuse Prevention Month, and November 25th is the International Day for Elimination of Violence, and the first day of the 16 Days of Activism. On December 6th, National Day of Remembrance and Take Action on Violence Against Women, we will be raising purple flags across municipalities in York Region, and this actually happens across Ontario. It's a provincial Wrapped in Courage campaign, now in its 10th year, and we typically wear a purple scarf or a purple tie, which is a symbol that really indicates that the courage of a woman is not enough. It's a symbol that indicates that we are committed to working together to eradicate gender-based violence. So I encourage you all to every November and up to December 10th to wear a purple scarf that you can purchase from your local shelter and show your support to abused women and children, and show your commitment that we can end gender-based violence. And on that note, I thank you for your time and your patience.